As we can see, over the last 5 years, the pass rate for the PLAB2 exam has declined. Unfortunately, approximately 5,000 doctors failed the exam last year. In this video, we will be looking at 5 top tips from a GMC PLAB examiner. Top tips on how to avoid common mistakes in the exam. The clinical situation in the stations are designed to be in the capability of a junior doctor. Therefore, examiners expect candidates to deal with the patient exactly as they would when seeing them in a clinic. Examiners are looking for real interaction with the simulated patient. Therefore, candidates are expected to ask questions that patients can understand. They are also expected to demonstrate their ability to actively listen and respond clearly and sensitively to them. Clinical knowledge is assessed in the Part 1 exam, therefore marks will not be gained for telling the patient all you know about the illness theoretically. Candidates are encouraged to be cautious about using stock phrases which are probably learnt from courses, as these can sometimes sound out of place. Examiners are aware of set phrases used by some candidates and often in the wrong context. Candidates can lose marks for interaction if such phrases are used without actually interacting with the patient in front of you. Candidates must check and understand what they are being asked to do. Make sure you read the station instructions carefully. If you have attended an academy, do not assume that you know what the station is about, as there are a number of different variations on particular scenarios. Do not be afraid to look at the instructions again if you need to. The station instructions are also available in the room. You could politely ask the patient to give you a minute to read through. Make sure you know how to assess suicide risk, as this is a very important skill in the UK. In short, you must be prepared for psychiatric stations. Be wary of offering analgesia. If the station requires you to elicit where pain is localized and which movements provoke it, you will gain no credit for offering painkillers. If a child is being discussed, ensure you get the gender of the child right and use the correct pronoun. Behave as you would in real life. Although the examination is in an artificial environment, the examiners judge candidates on how they would perform the tasks in the station in real life. A rehearsed preamble to consultations will not impress examiners. Acting AMD speaking naturally will impress examiners most. Make sure you know why you are doing something. In clinical examination stations, it is obvious some candidates have learned the sequence of actions by rote. Make sure you are clear about how to examine a patient and why you are undertaking each action. Finally, remember that an organized consultation is key to passing the exam. Candidates do not always go about their consultation in a logical and organized manner. If you ask a question and do not follow it up, you may be seen as acting by rote. I hope this video has been beneficial. There are more informative videos on this channel about the PLAB exams, the upcoming UKMLA exams, and other useful information for doctors interested in practicing in the UK. Do subscribe and watch out for upcoming up-to-date information relevant to health workers in the UK.